Two drugs interacting with each other. That's called a drug-drug interaction. I'm Dr. Megan, your Prednisone Pharmacist, and I'm here today to talk to you about drug interactions with prednisone and give you 5 ways to help avoid them. How to minimize prednisone side effects by avoiding side effects from drug interactions. First of all, prednisone is an amazing drug. It can do miraculous things, but in order to do its job, it has to go through your body. And one of the things that happens is your liver has to break it down from prednisone into prednisolone. That means your body is using your liver to make this drug work for you. That's how the drug interactions happen. Because prednisone is being broken down by the liver, we have to be careful with other drugs that are broken down by the liver because they might be broken down in the same way. So first of all, which drugs are a problem? Which drugs have a drug interaction with prednisone? First of all, we have things I mentioned with the liver. So ketoconazole, it's an antifungal drug. If you're having a terrible fungal reaction and you're on prednisone, then that's a drug interaction. Anticoagulants like warfarin, it can make your numbers go up or down, make you have a higher bleeding risk or a higher clotting risk. Things like that can happen because those drugs are broken down by your liver. What about other side effects that could be caused by a drug interaction? So one of the side effects I was always taught in pharmacy school that you should even warn people about, you should always tell people to take prednisone with food to stop the peptic ulcer issues. Well, guess what? They've recently discovered that the taking it with food thing didn't really matter so much as, guess what? Not taking the prednisone with certain drugs. And do you know which drugs those were? And other anti-inflammatories. So prednisone is an anti-inflammatory, and there are other drugs called NSAIDs, non-steroidal anti-inflammatory drugs. Things like ibuprofen, which is also known as Motrin, Celebrex, which is also known as celecoxib, naproxen, piroxicam, meloxicam. Those are all drugs that cause your GI tract to have problems. The combination of the prednisone and these other anti-inflammatory drugs is just too much. Let me read you a statistic really quick. It says that using prednisone, it means you have a 2-fold increased risk of a side effect in your GI tract when you're taking NSAIDs as compared to people who just use NSAIDs alone. So basically that's saying you have a 2 times greater risk of having problems somewhere between your mouth and the other end if you're using prednisone with NSAIDs like ibuprofen versus if you only use ibuprofen. And then here's the real killer. The use of NSAIDs plus prednisone or other glucocorticoids is associated with a 4-fold increased risk of side effects in the GI tract compared with not using either drug. So if a person is taking 0 anti-inflammatories, they have a 4 times greater risk if they use prednisone and ibuprofen together, or prednisone and Celebrex, or prednisone and naproxen, or whatever NSAID it is. And that's true for aspirin too. Let me see what this says right here. The aspirin, the levels of aspirin go up when you take aspirin plus prednisone. So you have to be really careful with those. So if you are prescribed prednisone, then you need to talk to your doctor about whether or not to continue aspirin. All right, so I promised you some tips about how to cope with these side effects. And I also wanted to give you a little bonus here that I didn't mention. So did you know that food is medicine? That means herbs are medicine and vitamins are medicine. All of those things you put in your mouth that affect your health, they're medicine. So we need to be careful too with herbs and things like that we take along with prednisone. So one of the things we need to be careful with is St. John's wort. And I could totally see somebody feeling depressed after taking prednisone and taking St. John's wort to cope. And that would be a terrible idea. That is a major drug interaction. Do not ever take St. John's wort with prednisone. Other things that can affect prednisone include alfalfa and licorice. And I can see licorice happening quite a bit because a lot of people think, oh, prednisone is depleting my adrenals, so let me give myself an adrenal support supplement. And licorice is one of the main ingredients in adrenal support supplements, and it basically is, they're counteracting each other. So you just don't want to start licorice when you're on high dose prednisone and you need it to do its job. I'm still out on whether you can do the licorice later on, lower in doses. We'll get back to you on that one. So the tips I promised, the 5 tips, the 5 ways to minimize prednisone side effects by coping with drug interactions. Okay, so first of all is timing. Now the timing would be to not take certain things at the same time as other drugs. So for an example, everybody on prednisone should be taking calcium and vitamin D, but calcium can interact with a lot of things because it's an ion. It's got 2 little plus signs next to it in the chemical name. It will bind other drugs. It'll make it so that they're blocked so that your body doesn't even absorb them. It'll just go in there and say, hey, I've filled the spot. And so calcium should not ever be taken at the same time as thyroid medicines like levothyroxine or iron because they'll block each other. They'll just get in the way of each other's absorption, which is another reason you never want to take a multivitamin that has calcium and iron in it because they're just blocking each other's absorption. So the timing would be take the calcium differently from the thyroid. You could give it at least a half an hour, if not an hour in between. There's not really a problem with taking your prednisone with your thyroid medicine though. They should be fine together since they're both taken first thing in the morning. All right, so the first one was timing. The second one is to stop taking the drug that is less needed. So going back to our example of taking ibuprofen with prednisone, since they are doing very similar things. They're both anti-inflammatory. They're both pretty much giving you pain relief from like joint pain and things like that. Then consider stopping the ibuprofen while you're on prednisone. That's a possibility. Always talk to your doctor before you stop any drug. But that's one way to cope. And so that can happen with other side effects, other drugs that you're taking. You can stop the one that's less important, and you can go through with your pharmacist and your doctor which are the very most important and which ones you can stop taking. We call that deprescribing. All right, the third one is to switch to a drug metabolized differently. So I was mentioning that the prednisone goes through your body and then has to be activated by your liver. And so if you are on other drugs that are using the liver to break them down, then you can switch to something that maybe is broken down by your kidneys. So for example, there's a whole bunch of drugs for depression. Like there's a whole class of drugs and they're all very similar. They all work almost the exact same way, but some of them are broken down by different parts of the body. And so if you use one that is broken down by a certain enzyme in the liver instead of one that's broken down by another, that's one way to cope. And then back to prednisone itself, one way to cope with timing and switching to another time frame is using the drug Rayos. That's a extended release version. And so people who have things like rheumatoid arthritis, they can take Rayos at bedtime so that the prednisone is released slowly over the night so that when they wake up first thing in the morning, that it's already kicked in, that when they're having their very worst symptoms of rheumatoid arthritis, that the Rayos has kicked in and is knocking those symptoms away for them. So that's another strategy you can use is changing the timing, changing the drug metabolism. All right, number 4. If you have to use prednisone with ketoconazole, the ketoconazole is blocking the breaking down of prednisone. So that means there's more drug floating around in your body. So what should we do? We should lower the dose of the prednisone because there's more floating around, less breaking down. So that's what we should do when we give ketoconazole with prednisone. The opposite here is to raise the dose with other drugs that have an interaction with prednisone. Excuse me. Things like phenobarbital and phenytoin and rifampin. They are classic drug interaction drugs that increase the rate that the prednisone is broken down. They make the liver work faster. And that's not necessarily a good thing. It just is what happens. And so you'd want to give more prednisone for those people who have an anti-seizure need. So the ideas were to change the timing, to discontinue the drug that's not needed, to switch to a drug that's metabolized differently, to lower the dose of the prednisone, or to raise the dose of the prednisone. If you have questions about this, you should talk to your doctor and your pharmacist. They can help you troubleshoot this. They have the skills, especially your pharmacist, to optimize your medication therapy so that you can minimize the side effects and feel better. And if you need any more tips about prednisone, I have a prednisone wellness checklist, and you can get it at the link below. Signing off as Dr. Megan, your prednisone pharmacist.